Hello, today we are going to talk on corrosive esophagus and stomach injury. इसका मीनिंग है एसिड पीने से अन्नली और स्टमक में इंजरी. So this is a very dreaded or serious disease and commonly found in a world. It's found in India. It is not common in Western countries. Important for this disease is there because this is always bite the young people, young female, and occasionally pediatric बच्चे को ये होता है. उसका और ये लंबी, इट्स अ वेरी लॉन्ग ट्रीटमेंट, सो लॉन्ग मॉर्बिडिटी इज देयर. सो द थ्री फैक्टर्स आर एंड वेरी पुअर पीपल में होता है. सो कॉमनली व्हाट आर द कॉजेज फॉर दिस इसोफेगस इंजरी? तो occasionally due to the accident, and it is commonly found in the children. When children in house, people are keeping vinegar acid to clean the toilet and bathrooms, and the children looking to their color, they consume accidentally and they got an esophagus and stomach corrosive injury. But commonly found into the India, it is due to the suicidal attempt. So male or female, they have so many social, financial problems. They took an acid for the suicide, and they consume the acid. It produces corrosive esophageal injury. So how this injury, what this acid do into the when patient swallow the acid, what it will do? Usually when the patient swallow the acid, it bites the tongue, lip, pharynx, and when swallow it goes into the esophagus and it stay into the stomach. So maximum damage it will be done into the stomach, and the fume, this goes into the trachea and lungs, and it damages the lungs also and epiglottis. So how this patient presents? Though patient came in the OPD, occasionally they may not give the history that they have consumed acid, or they may not be knowing by when due to the accident, but they are having a severe chest pain, retrosternal pain, epigastric pain, nausea, and occasionally hematemesis, and they are very sick, very agonizing pain. So this patient present in emergency with these symptoms. When we examine abdomen, look not distended, no tenderness, but patient is having a severe pain. So this patient when came to the hospital, how we are managing this acid corrosive acid injury patient? So it having a two part of management. It is a very long management. One is an emergency or immediate management, and one is a later management. So immediate management, when patients comes into the history, the life saving problem is they have consumed the fume into the lungs, or injury to the trachea, and they may have a breathing difficulty. They have an oxygen is low and breathing difficulty. So this patient immediately required an intubation, or if it is not possible, then a tracheostomy, because we have to secure the respiration. Otherwise, this patient may die without the oxygen within 2 to 3 minutes. So when patient is in respiratory distress, we had done a tracheostomy and stabilize the patient. If patients having a no respiratory injury and patients came with the pain, then immediate management is in pain management. We give an higher dose of analgesic. So first to relieve the pain, give antibiotic to prevent the infection, and IV fluids. So it takes 24 to 48 hours. Patient will slowly the pain disappear and patient stabilize after 3 to 4 days. We maintain with the IV fluid. Occasionally these patients develop, then they swallow the corrosive, and his corrosive acid stay into the stomach, and it produces a perforation or hole into the stomach, and this whole acid goes into the free abdomen. So this type of patient required an emergency surgery. We have to remove the stomach in emergency. So this is an immediate management. After 2 to 3 days, when patient stabilize, no pain is there, then we have to think of the nutrition, how we can give the nutrition. So after stabilization of the patient, usually we do an endoscopy, upper GI endoscopy, and endoscopy will grade the esophageal injury. If it is a grade 1 injury, within 2 to 3 days, patients take orally. Slowly we increase to the soft diet, and weak patient will have a full diet, and there will not be any problem. But patients having a severe injury, when the mucosa and submucosa of the esophagus and stomach is already charred, it takes long time to heal. So this patients require nutrition. Usually we do a feeding jejunostomy. We put them on a small tube by operation into the small bowel or jejunum, and we give a liquid food from the jejunum. And now that is already jejunal feed is available, formula feed. We can give that feed that gives enough protein, carbohydrate, fat and energy and volume. So patient nutrition will be maintained, and we'll wait. We'll put patient on this parental feeding jejunostomy nutrition, and after 20 to 30 days we do an endoscopy to assess the stomach and esophagus. So the after injury, after 2 to 3 weeks, 4 weeks, there will be a stricture. Stricture means narrowing of the esophagus and stomach, and it requires dilatation. We do dilatation means we are under SIAM, under anesthesia. We do a gradual dilatation, and we keep dilating the esophagus till become 15 or 14 millimeter of dilatation. So many patient required 1, 2 or 3, maximum 4 or 5 dilatation patient required. And many patients having a very tough stricture, it will reoccur again after dilatation, it reoccur again after dilatation, it reoccur again, then it become a refractory stricture and it required a surgical correction. Particularly pyloric strictures, when the acid damages the esophagus, stomach becomes cicatrized and small in size, and the pylorus is obstructed. So this patient required in replacement stomach. We have to remove the stomach, and then we have to make a pouch from the jejunum to work as a stomach. So though if dilatation is successful, then we do 15 days, where then we increase the duration, 1 month, 3 month dilatation, and patient take orally, and then we'll remove the jejunal tube. Those patients having a stricture or resistance stricture or refractory stricture not responding to the dilatation, this patient required replacement of the esophagus. So esophagus अन्नली को replace करेंगे, वो colon बड़ी आंत से और large intestine, we put a graft, vascular graft of the large intestine from the abdomen to the neck, and we do a replace the esophagus with the colon. This is called a esophageal replacement or colonic interposition graft. So this when patients start taking orally. And if stomach is damaged or contracted, then we remove the stomach and we make a jejunal pouch and do an anastomosis with the esophagus. So patient will have a normal diet. So at the end, this all patient, corrosive injury, those who have a stricture in stomach or esophagus, they become a normal and they go into the normal stream. They can have a normal diet orally and they become a normal person. But it required 4 to 5 month treatment, multiple dilatation, multiple surgery. So this is a very long process, and with the morbidity, and occasionally there will be a mortality also. So this is a disease. How can we prevent this disease? The prevention is better than cure. So prevention in child, we should not keep this acid in a handy with the child. We keep in some compartment or some lock and key, so it will not accidentally taken by the child. And for suicidal, if we came across such problems, some matrimonial problems or financial problems, then we reassure the patient. We need some psychiatric consultation of the patient, and we should make sure that patient will not take a suicidal attempt. And after this one suicidal attempt, we have to consult the psychiatrist for the patient's condition, because normal patient will not take an suicidal action such type of, so they have some psychiatric problem. So prevention is better than cure, and it is a curable disease, but required an expert for this management of this acid peptic corrosive disease in a specialized center. Results are excellent. Thank you very much for patience hearing and kind watching. Just a minute.